My name is Nancy Schrum, Director of Constituent Services in the Office of County Executive Steve Shue. Today, we're here conducting the fourth of a five-part series on Facebook Live on the heroin and opioid crisis impacting our communities and families in Anne Arundel County. So I'd like to introduce County Executive Steve Shue.
Good morning.
And our Acting Health Officer, Fran Phillips. Morning. Thank you for being with us this morning. County Executive Shue, you were in office less than 60 days when you declared heroin a public health emergency. How did you know our county was in the throes of addiction?
It was obvious. Going back 2.5 years ago, we were on track to have about an overdose a day and a fatality a week. And that's exactly how that year turned out. Almost 350 overdoses in the year ended just 2 years ago, and about 50 fatalities. That was unimaginable to me, and it was those statistics and the many horror stories that go with numbers like that that led us to declare a public health emergency. That public health emergency galvanized the attention of every county employee, public safety, health, and others that are relevant to this crisis, and also public attention. And I think started bringing this problem into the public consciousness for the first time, because people weren't talking about it. It wasn't very long ago when nobody was talking about it. Hard to believe today, because now everybody's talking about it, thank heavens, and that, I think, is a big part of why we're going to beat this thing, because people now do understand the severity of the problem and that we all have to take action. The statistics are not getting better, and in fact they're getting worse. In the subsequent year, the overdoses and fatalities were up 2 to 2.5 fold. In the year just ended, we had, instead of 48 fatalities, we actually had 120 fatalities. Instead of 350 overdoses, we had nearly 800. And so far this year, I'm afraid that the numbers are up yet again. We are on track this year to have probably close to 140 fatalities based on current trends so far this year. It's very, very frightening. What has fueled the acceleration in fatalities and overdoses is the emergence of synthetic heroin-like substances, opioids, that are incredibly deadly. Things like fentanyl, carfentanil, elephant tranquilizer, a speck of carfentanil, the size of the point of a pin, not the head, the point of a pin, is enough to stop a human heart. That's how dangerous these substances are, and why it's so incredibly dangerous that drug dealers are mixing these compounds into heroin to stretch its effects and to make it go further, to expand their profits.
Well, 2.5 years ago, when you declared heroin a public health emergency, you also put in place the Heroin Action Task Force.
Right.
And tell us a little bit about the Heroin Action Task Force, its purpose, and its progress up until about 4 months ago, when then that task force was absorbed by what we call the opioid intervention team, yes. And how that came about.
Well, we initiated a strategy on the heels of the declaration of the public health emergency to attack heroin from 3 different avenues. One, from a healthcare perspective, to help people get the treatment they need, to get them into rehab. The second avenue was from a public safety standpoint, to go after the dealers through the police department, through the sheriff's office, to get the dealers in jail where they belong so they can stop peddling poison. And then finally, education, which I've always believed is the long-run solution to this problem, to educate young people about the dangers of these drugs so that they don't start in the first place. Because everything else we do from a healthcare perspective or a law enforcement perspective is a rearguard action. We're already dealing with somebody who's addicted. We need to stop people from getting addicted in the first place, and that's why education is key. To pursue all 3 of those avenues, we formed the Heroin Action Task Force that you know very well, And the Heroin Action Task Force consisted of county departments and offices, probably a dozen different ones. The health department, the department of the fire department, the police department, the sheriff's office, the state's attorney, health and human services, numerous departments of county government, everybody that was relevant. And they came up with at least 35 different recommendations that were all actionable, great ideas, best practices taken from all over the country, and they have all been implemented in Anne Arundel County. I think we are setting a standard and an example for the rest of the state. We are probably ahead of the rest of the state in terms of implementing those kinds of interventions to get this crisis under control. We are starting to see some signs that it's working. We are seeing a slowdown in the rate of growth. I'm starting to grow more and more confident that this crisis is beginning to crest. And once it crests, hopefully we can turn it into a downward trajectory. We are seeing incredible success of our Safe Stations program. Safe Stations is the program whereby we've designated all of our fire stations and police stations, police barracks, as safe places for people to go to get help. If a person is suffering from addiction, he or she can present himself at the fire department or the police station, no questions asked. Nobody gets in trouble. You just get the help you need. So if you're out there and listening this morning and are suffering from addiction, there's help. You just got to ask for it. And the good news about Safe Stations is at this point, we have had more people present themselves to fire stations for help than we have had people dying from overdoses. That's a historic first. And once people present themselves for help, we get them into the services they need and they can begin to get their lives back.
Wonderful. Mrs. Phillips, 2.5 years ago when we had our first public forum, the Heroin Town Hall in March of 2015, what we heard from very angry parents about treatment. So for today, for our audience, if someone wants treatment today and they want to call the health department, how does the health department engage with our citizens for treatment?
Right, great, thanks Nancy. And it's a pleasure to be here to talk about what really is the number one public health problem facing the county, and really we're not alone in this, the state as well as lots of parts of the country. And it's really gratifying to me to come on the team with the county executive with the kind of leadership. I've come in to this acting position in the health department since June 1. It has been what we have been working on every single day, but as the county executive said, the kind of leadership that's already put all of these initiatives in place has really jump-started, I think, so much of our response. You asked about children, about parents and education, and that's where it begins. And so there are incredibly strong programs. I will say other counties are trying to duplicate our programs. The keynote program is the Not My Child one, which is now making the rounds through the schools, with parent associations this summer, through libraries and in public settings, at workplaces, and will start back up when school starts next month. Again, engaging parents to understand more awareness about what this problem is and to start the conversation at home. It's never too early to start talking to children about the dangers of drugs. And so how to get that conversation going is really fundamental to the Not My Child effort. There is also a tremendous resource in every single Anne Arundel County school, and that is the school nurse. The school nurses came together last week. They are excited and enthusiastic to get back to their health rooms in every school. And the number one thing that this 101 group of nurses wanted to talk with me about was what can they do, how can they help with education against the opioid epidemic. So that was truly heartening because they have tremendous energy and they are right there in the schools every day working with the students but also with the parents and the school staff. So let me give you a phone number, if I could, as far as reaching out to the health department for help. And this is any kind of help. This could be a parent asking questions. This could be a person who's in trouble who needs to get access to treatment. This could be a family that thinks that they have a family member and want to have some support information. The one line for the health department is 410-222-0117. And that's a line that's available, staffed by a professional counselor. A person will come on with great knowledge about our system in Anne Arundel County, where treatment exists, what the levels of treatment are, and what would be the right source for the person that's calling. There's also a website. If you don't feel comfortable calling, the website's open 24/7. It's www.denialisdeadly.org. Same information.
Wonderful. I wanted to comment, Holly. Holly says we pray for no new users. Holly, if you've maybe you've attended a Not My Child presentation in our one of our many communities where we've been, that is actually a theme under Not My Child is no new users, and hopefully education and the that we're providing will create the prevention with the goal no new users. Thank you for throwing that out. That's really important that we focus on no new users. County Executive Shue, can we talk a little bit about law enforcement? What's the role with our chief of police and what they have in place and what might be coming forward to combat this problem?
Well, law enforcement is one of the three legs of our overall strategy for combating the opioid crisis. But law enforcement alone is not going to solve this problem, because we can't arrest our way out of addiction. We have no interest in putting addicts into jail. We want to put addicts into treatment. So when our police officers and sheriff's deputies encounter someone who is suffering from addiction, not dealing, but just themselves suffering, we don't want to put that person into the judicial system, into jail or anything like that. We want to get them into treatment and connected to the services they need. It's a real different story when it comes to dealers. When it comes to dealers, we are ruthless. Our police and sheriff's deputies will do everything in their power to arrest that person, to prosecute that person. We have been working very closely with the state's attorney, Wes Adams, who has taken a very aggressive posture with these dealers. The days of easy plea bargains are over in Anne Arundel County. If you're dealing heroin or synthetic opioids, you are going to jail for a very, very long time. Anne Arundel County is the last place you want to be if you're a drug dealer.
Layla Warren writes, what can doctors do to help patients who may need or want medicine for pain? County Executive Shue, you just recently released over 1,300 letters to many of our local primary care providers. Can you tell us what was in the letter? What did you ask of our doctors?
Yes, we've learned a lot over the last 2 years in dealing with this crisis, and one of the things we've learned is that the vast majority of people who are suffering from opioid addiction began their journey with prescription drugs, from a sports injury, a surgical procedure, something like that. They went to a doctor and were prescribed opiates, maybe oxycodone or Percocet, something like that. And unfortunately, there are physicians in this community that overprescribe, who provide 30 days or more of prescriptions when 3 days would have done the job. And as a result, people are getting addicted to these drugs. After their prescription has reached its end, they then start buying, out of desperation, they begin to start buying prescription drugs on the street at exorbitant prices. They run out of money, and then it's a very short trip from there to visit the heroin dealer, who offers heroin and synthetic opioids at very, very low cost compared to street prices for pharmaceuticals. That's how it happens. Nobody wakes up in the morning and says, I want to shoot up heroin. It happens by slow increments as a person sinks deeper and deeper into the dark world of addiction. So the doctors are playing a role here, and it's not always a positive one. We do know that there are doctors who are overprescribing in this county. We know exactly who they are because we can track their prescription habits, their prescribing habits. We recently sent a letter to every physician in this county asking them to think carefully before prescribing opiates for pain, and if they do determine that opiates are appropriate, to prescribe them in the minimal amounts necessary, the smallest amounts necessary to deal with the problem at hand, but no more, so that those drugs don't lead to addiction either by that patient or wind up sitting in a medicine chest where they can eventually be taken by children or by the plumber or electrician or somebody else who comes into the house.
I also like to offer that during the Not My Child conversation, we talk about how we have to be our own advocate when we go to the doctors. We have to ask a lot of questions, understanding what's being prescribed to us. Because one of our moms that sits on the panel, who still is supporting and trying to keep a son alive because he's relapsed many times, she outwardly says pain does not kill. So we encourage everybody to use some ibuprofen, really think twice and be your own advocate before you start using a narcotic that is addictive.
Right. It's like you say, Nancy, it's a good idea in the doctor's office, if you are getting a prescription, to ask about it, to ask, is this an opioid? Is there another medication that could be as effective? Or is there something else that I can do? You know, for some kinds of pain, perhaps not acute pain, such as a fracture or a sports injury, but for chronic pain, for chronic low-level pain, as in arthritis or nerve pain or back pain, opioids may not be the most effective thing. It may be more effective to have non-opioid medication, even to have physical therapy, to have massage, to have acupuncture. These are some techniques that have been shown to be effective for chronic pain. So go ahead and ask your doctor about it. I think that's the message.
Great. Well, let's talk about Narcan and its accessibility to our citizens in Anne Arundel County. If someone today wanted to have Narcan available to them, how can the health department help them with that?
Okay, first let's talk. Narcan is, as most people know, it is an absolute wonder drug. Narcan saves lives. So if a person is in the throes of an opioid overdose, and by that I mean they are non-responsive, they may not be breathing regularly, they may look like they are blue or very, very pale, you know these people are very, very sick and it's a life-threatening condition. Narcan is a wonder drug because if the problem is an opioid overdose and you administer Narcan, which is very easy to do, it's a nasal spray, it can wake that person up literally in 3 minutes. And I've seen it happen in the emergency room. Now it's available through the community, which is so important for people who perhaps have family members that are in recovery, to have that available in the household in case of an emergency. Used to be you needed to have a prescription from a physician and you needed to get training and certification. That's all changed now. So that in the state of Maryland, you can go to any pharmacy and you can ask for a dose of Narcan, and a pharmacist will deliver that to you, hopefully right then and there with some instructions on how to use it. Again, if you have any questions about how to get Narcan or what to do with it, call that health department number and we'd be glad to give you information about that.
Great. Our crisis response team, they're busy, and they play a huge role in response to those seeking treatment. County Executive Shue, I understand you've done a ride-along with crisis response. Can you tell us about what did you experience?
Crisis response is an absolutely incredible group of people who are the unsung heroes of this crisis. They are on the front lines. They're 24/7 to help people who are in crisis. I mentioned safe stations earlier. Let's say that a person presents him or herself to a fire station for help. The fire station will do an immediate medical assessment and make sure the person is not about to suffer a severe medical incident, and that they're able to be triaged into treatment. At that point, the fire department alerts crisis response. Crisis response is a group of people, and they are led by Adrian Michler and Jen Corbin of our mental health agency and of the crisis response agency itself. And the crisis response team will come to the fire station and meet the person, and they will begin the work of helping that person recover. They will perform initial interventions and then get them into the right treatment setting here in the county where they can begin their journey to recovery. So I just want to give a shout out to the crisis response team. The work they do is absolutely incredible and setting an amazing example, not only for other jurisdictions around the state, but throughout the country.
Fran, can you answer P.C. Chamberlain's question about I can't even
About
pronounce.
benzodiazepines with Narcan, which is not correct, which is not an opioid. So benzodiazepines are a type of, it's a category of drug. It is not they are not opioids. They are drugs such as Valium, and they also can be very, very addictive. They have you have a tendency to become tolerant, to become dependent, and really they can be very, very troublesome, especially when a person is taking benzos along with an opioid product. So again, it's a question of being your own advocate. Talk to your doctor. If you have two doctors, make sure they're talking to each other so that when you get a prescription, the doctor has the full information about everything else that you're being prescribed at that time.
You asked about the letter that we recently sent to physicians. In addition to asking doctors to be very careful about prescribing opioids and to limit the amount of these prescriptions, we also mentioned that they should be extremely careful about prescribing benzodiazepines or benzos with opioids, because the combination of those two can be very, very dangerous and very, very addictive. And as the health officer said, if your physician is suggesting that you should have both benzodiazepines and opioids, you should ask a lot of questions about that, because that is a dangerous brew.
There was a question regarding the treatment options that we have here in the county. Wasn't Sherry? No. Can you scroll? Can you scroll? Well, let me ask this question, Fran. What relationship do we have with the nonprofit world that really has a huge responsibility from counseling, inpatient, outpatient services for our citizens? What relationship do we have and involvement do we have, meaning government with the private sector? Right.
So we are part of a larger system in this county, and we have tremendous providers, both nonprofit and in the health department as far as an outpatient clinic. We have providers, nonprofit providers, for high-level residential treatment. We have providers for step-down recovery treatment, outpatient providers, a whole mix. The job of the health department, one of the jobs, is to coordinate that mix so that we have an easy way for providers to talk to each other. Really important when you are referring a patient who's in the process of recovery. That's a long process. Start at one level and then be successful, step down and do a warm handoff, so to speak, to the next provider. We are organizing a communication system in our county so that for the first time, providers can easily talk to each other without making 20 phone calls every day for each patient. So part of that is to organize our system together. We have, as I said, high quality providers, but we just need a better way to integrate and make sure that they're all talking to each other.
Great. Mike Cohen, the crisis response team is great, but there are not enough beds available because of a lack of qualified addiction counselors. Too many people are not getting the treatment fast enough. This is a national problem, not just our county. That would be a correct statement?
Mike, thank you for that.
Yep.
That's absolutely correct.
Dead on.
Right, and so everything that we can do to increase the workforce, certainly working with our community college on bringing qualified counselors into work. I will say that there's been a tremendous interest and great success with engaging people who are well on their way in recovery. They're stable, they're in recovery, and now they want to give back to the community. And so through the health department, we have a group of peer support counselors, people who have gone through training and certification, but they have had the life experience themselves of having been addicted. And so they are terrific as far as engaging people into treatment and then to work with the professional counselors, which you're right, Mike, we don't have enough of. We're working on that supply, but to really use peer counselors as a support there.
Great.
As the health officer said, Anne Arundel County, our health department and our mental health agency are part of a much larger network of providers that are standing ready to combat this crisis and are in fact combating it every day. The vast majority of those providers are nonprofit organizations spread throughout the community. And we are working with those providers to bring more beds into service. Godenzia recently opened up a large number of beds. The Pascal Crisis Response Center in Crownsville has just brought on a large number of beds. So we are working hard to stay ahead of this, or to, I should say, catch up, because the need has outstripped the supply. by a measurable amount, as the questioner pointed out, and we are working hard to catch up as quickly as we can. But we couldn't do it without the nonprofit and community-based providers that are helping us each and every day. We're grateful to them for their partnership. And if you have an interest in getting a feel for the full scope of the types of services that are out there, that are available in the community, come to one of our Not My Child events. I'm sure Nancy has some scheduled that she'll be mentioning in a moment. But come to one of those events. What we do is we encourage all the nonprofit providers to set up booths all around the lobby during the event, so that either before the formal presentation or just after the formal presentation, you can interact with the providers and understand the services that they offer to assist people into recovery.
Right. Emily writes, I'm a county resident and current graduate student studying criminal justice. I'd like to be more actively involved in combating this problem. What can I do? Well, Emily, I would suggest that you become engaged with our prevention coalitions through our health department. So I'm going to ask Fran to elaborate and talk about the role of community and how community can become engaged via one of our many coalitions.
Great. Yeah, thank you, Emily, for that. It is so important not just to have professionals and government support, but really working in communities for people like yourself, Emily, that have a particular interest in a particular background, yours being in criminal justice. There are 4 coalitions very active across the county in all the quadrants of the county. These are coalitions of community people, all walks of life, and they bring a lot of different expertise and perspective. So again, to get involved with those coalitions, let me suggest, again, you call that health department number, and depending on where you live or where you work, we can connect you with the one in your community. And that number, again, is 410-222-0117.
And also, there's a website, www.preventsubstanceabuse.org. That is the coalition's website. You can find all kinds of good information for actually parenting skills that we need today regarding the misuse of substances, and that includes also alcohol and marijuana, not just the illegal prescription drugs that are on the streets and the other substances. I'd like to ask the question that Lisa brings up, because this does come up. Why methadone as a form of treatment?
I don't quite so let's talk about methadone. Methadone is one of 3 medications now that are effective in working with people who have come into substance abuse treatment. They need 2 things. They need counseling, and they need one of these types of medications, methadone being one, Vivitrol being another, and buprenorphine being the third. These are medications that are very helpful to the patient to block the craving, so that the person can calm down. They don't have that intense need for the opioid, for the substance, and in so doing, they can attend to their lives and their counseling. So methadone is very, very effective. It's been around for years and years and years. It needs to be monitored, and we have a terrific methadone clinic, 2 locations in the county, one at Langley Road in North County and around Glen Burnie, and then the other Bestgate Road in the Annapolis area.
Right. Well, since we're talking about methadone, how about let's go to Suboxone and Vivitrol.
Okay, those are the other 2 that I mentioned. Suboxone being the brand name for buprenorphine, so that's the same drug, and Vivitrol. These are 2 other drugs that, again, block that craving. It allows the user to become much calmer, much more able to attend to their life and get their lives back in order, and really to engage with counseling. Very, very effective. Studies have shown that people that have medication-assisted treatment along with counseling do much, much better. It's not to say that it's not foolproof. What we're dealing with here is a chronic disorder. People from time to time will relapse, but the chances of that happening with one of these medications is far lower.
Right. So let's talk about the storage of medications. Many people have medications in the medicine cabinet. What would you recommend regarding storage and disposal of medications?
We should change the name of medicine cabinet. It should not be called medicine cabinet, because your medicines, particularly your prescription opioids, do not belong in the medicine cabinet. It's the worst place to put them. Medications like this, you have to think of as being a hazardous substance. You cannot leave them around. If you have unused medications, get rid of them. How do you get rid of them? Every one of the police department stations, Northern Station, Western Station, Southern Station, and Eastern Station, every one has a walk-in drop box 24/7 where you can dump that stuff and get that hazardous medication out of your house. When it's unneeded, get rid of it. It is a hazard, as the county executive said. People come into our homes, we don't know who they are, and lo and behold, the medication's gone. That adds, in the diversion, that adds to the supply that only can spell trouble for people.
Can they be returned to the pharmacy?
I have heard that there's one pharmacy, and I won't say their name, one chain, that is accepting returns. So, good question. If you go and pick up your your prescription, ask at that pharmacy, can you bring it back there? So I think that's something that all of the pharmacies now should begin to adopt. It's a safety measure.
And I assume we don't want people putting them in the toilet to dispose of them,
No,
right?
it's not a good practice. I think our Director of Public Works would have something to say about that in terms of making sure that we don't inflict environmental damage. So not a good idea to flush them down the toilet, but absolutely get rid of them, get them out of the house. While you're taking them, keep them in a secure place. Keep them in the original bottle, but don't keep them in the medicine cabinet. Keep them someplace else.
So if someone has been, let's use this as an example, I've been prescribed a narcotic for pain management. How would I know? What are the signs and symptoms that I should be paying attention to that I might be acquiring an addiction?
Very good question. Very good question. The first thing that you might start to think about is, am I taking these pills more often than I used to? Am I taking a double dose? In other words, is my body beginning to develop tolerance so that the dose that I started out with isn't effective anymore? That's question number one. Then you want to say, am I really kind of organizing my day around when I can take my next pill? What that is the beginning of dependence. So there are these subtle signs that you need to watch for. If you see that, that's immediately, that's a time to check in with your doctor and get that medication adjusted. Because the steps are tolerance, dependence, addiction, and then unfortunately, overdose. So it's a bad pathway to be on. If you see yourself loading up on those doses, check back in with your doctor right away.
Okay, so let me follow up with, I just pulled into the gas station or to a parking lot. A lot of people coming and going. How would I understand what are the signs and symptoms of someone actually overdosing?
Well, tragically, we read about these cases of passersby who see someone slumped on a chair or have fallen, and you're not quite sure what's happened. You're not quite sure, is this person having a heart attack, overdosing, asleep? You're not quite sure. The first thing that you want to do is call out their name. Say, hey, what's wrong? Be loud, be assertive, and if there's no response, the second thing you've got to do is call 911. You just have to call 911. In our county, we have a tremendous response. The 911 operators not only will dispatch to the scene, but they'll also walk you through the next steps as far as whether or not to begin any kind of life-saving CPR, or if you have Narcan available, what's the next step? The number one thing, if you're not sure and you can't arouse someone, call 911.
County Executive Shu, FY18 budget, funding for the support, the resources. Can you talk a little bit about that? And are there any resources out there that maybe we might be going after?
Well, we've dramatically increased funding for providing services and for addressing the public safety demands that this challenge has put before us. These things cost money. On the public safety side, having a dedicated narcotics unit, having more personnel with better equipment cost money. On the provider side, we've recently opened a health clinic in the Annapolis area to help people get through their addiction. We are expanding our crisis response team with more personnel and more vehicles. That all costs a lot of money. We have been fortunate to have a great partner in the state of Maryland, which has been assisting us with grant funds that most recently enabled us to increase crisis response and also to expand our educational efforts. So this is combating a crisis like this is not free, and it's not inexpensive, and it is unfortunately diverting resources from other things that we would all much rather be doing. Improving recreational amenities and improving salaries for valuable county and school board employees, but we have to deal with the crisis at hand.
Right. I'd like to give a shout out to Angel Trainer, chair of ROSC, the Recovery Oriented Systems of Care. That is the umbrella group for our nonprofits that are providing treatment options for the citizens of Anne Arundel County. Tomorrow, August 31st, is International Overdose Awareness Day. Big event happening tomorrow night up in Glen Burnie at Arundel Christian Church on Aquahart Road. It's going to be an event remembering those we have lost through this crisis. So if you haven't heard about it and you'd like to attend, it's open to the public. Please plan to attend. The doors open at 7 o'clock tomorrow night at Arundel Christian Church. Thank you to Angel and ROSC for making this event happen.
Will service providers be present, or is it more of a rally?
No, it's more about remembering people that in memorial, exactly. But there will be people there to answer questions if you do come in and you're seeking help. It's not a resource fair per se, but if you need help, there will be people there to talk to. Yes, yeah. So moving forward, Not My Child. Our next event is in Riviera Beach in Pasadena on September 6th. Those events start at 6:30. We've been across hitting our libraries this summer. We've been to many libraries, so that will be our next event. You can also access our Not My Child webpage. Calendar events is available online. I have already on the calendar about 14 events taking place between September 6th and November 28th across the county. So there's lots of options for our citizens to get out and participate in that conversation. So County Executive Shue, let's go back and talk about the internal workings of the opioid intervention team. How often do you meet with the core group, and how do you see that moving forward?
Well, let me answer that in just 1 second. I want to go back to Not My Child.
Oh, okay.
Not My Child is an award-winning program developed by Nancy Schrum and our health department that has helped hundreds, if not thousands of people now deal with this crisis and helping them get their lives back. If you have not attended a Not My Child program, you should. You will find it very, very worthwhile. The program begins with a short video that will make chills go up and down your spine, and it's quite powerful. And then the program goes into a panel discussion with experts drawn from different fields, from health, from the academic world, from the law enforcement community. And they touch in this panel discussion on each and every aspect of this crisis. And then it goes to Q&A and to people sharing their stories. It's absolutely incredible. And so as Ms. Schrum said, the next one is in Riviera Beach. What day?
September 6th on Duval Highway across from Northeast High School.
Okay, at the library?
At the library, starting at 6:30.
6:30, library, Riviera Beach. And please try to join us for that event. In terms of the opioid intervention team, as we discussed at the beginning, Anne Arundel County set up its own heroin action task force at the very beginning of all this. We were kind of on our own, doing the best we could without a lot of direct connection to other counties or to the state of Maryland. That changed pretty quickly when Governor Hogan and Lieutenant Governor Rutherford formed the state-level opioid intervention team to take a statewide leadership role in combating this crisis. And they have done a tremendous job of getting the state organized and making sure that all the counties are in communication, making sure that all the counties are utilizing best practices, and that practices that are proving useful in Allegheny County can be transferred to Worcester or to Anne Arundel County, and to make sure that we're all following a consistent overall strategy that will lead to success. Until the Hogan administration took this leadership position, every county was running around in its own way, going in its own direction, and we were not seeing the best outcomes that we could see. So I'm really excited about the role that the state is now taking in providing this overall leadership. Not only that, as I mentioned earlier, they're providing a lot of funding that is absolutely critical to dealing with this crisis. And the opioid intervention team at the state level is meeting regularly with the opioid intervention teams at the local county levels. And our Heroin Action Task Force has now been reconfigured into our own Anne Arundel County opioid intervention team that works directly with the state.
Right. I'd like to, PC Chamberlain, how do I get my county active with our own plan of actions? Well, PC Chamberlain, I would recommend that start with contacting your health officer in your local jurisdiction to
Right.
get the information on where your county may be at this point in time. I know just yesterday Wicomico County reached out to us, sharing with me the steps they're going to take, and they actually asked me what worked for us of what they're thinking about implementing, and my response was it all works together, not just one over the other. It all works together, and we have gotten many phone calls from beyond our borders, in Arundel County borders, asking us how we do what we do, and we're more than willing to share. So if you want to reach out to your county and start with them, if you want to give me a call, I can talk to you a little bit about it. Maybe that'll prompt you to make that phone call to the appropriate government agencies where you live. The state's attorney, Wes Adams, sits on the panel. He's committed to the Not My Child panel. He attends every event, and if he himself cannot be in attendance, he sends another attorney from his office. So County Executive Shue, what is the role of the state's attorney's office in combating the opioid problem?
It's a big one. The state's attorney has a very significant role. In terms of helping educate the public, Wes Adams, our state's attorney, has been an invaluable participant in the Not My Child events throughout the county and sharing with the general public his perspective from law enforcement. His most important responsibility is, of course, because he's our state's attorney, is to prosecute criminals.
Right.
And we had a sorry history in Anne Arundel County of going easy on drug dealers, of plea bargaining down to lower levels and letting people get off with a slap on the wrist. Those days are gone under this state's attorney. This state's attorney is ruthless when it comes to drug dealers. They will go to jail. They will go to jail for a very, very long time, and they will be prosecuted to the fullest extent of the law. And then finally, the state's attorney is playing a very important role in getting people into treatment. As I said earlier, we are not interested in putting addicts, people who are suffering from addiction, substance use disorder, into jail. I don't want them in jail. The state's attorney doesn't want them in jail, and neither does the Department of Detention Services. Nobody wants those people in jail. We want them in recovery. And so Wes Adams is playing a very important role in identifying people who are not hurting others through dealing, but rather just suffering themselves, who need to be diverted through drug court or other alternative means of intervention in getting them into the services they need. So I regard State's Attorney Adams as a critical partner in our efforts.
Right. I also can add to that, because I'm with the state's attorney at all the Not My Child events, and one piece he also talks is about legislation.
Yes.
He's very active with our state delegation in legislation.
If I can add to that as
Sure.
well, another role of state's attorney is to, as he has, work with us where we have information not about street dealers, but about unethical or illegal prescribing practices. And so we found our state's attorney to be extremely open to that, very, very interested in following up to see what his office can do as far as stopping that supply coming into our county as well.
Right. So let's use this example. I know someone that has a severe problem that needs help. If I were to pick up the phone and call the health department, what 3 tips would they give me, the person trying to support someone in addiction, of how to move on and at the same time help that person? Or
Right. So that's a call that we often get from family members or from friends concerned that they are not enabling an addiction, but rather supporting a person to move forward and to get into treatment and get to recovery. So again, we have counselors that are able to walk someone through those steps and what some tips would be. But I do want to give another number that's really important that we've talked about a lot of numbers and websites, but short of 911, there is a 24/7 crisis line. This is the crisis response team in our county that we've all talked about as being really the heart and soul behind Safe Stations. These are the counselors that go up and down I-97 responding to Safe Station calls, and they have a 24/7 line. The number is 410, I want to get it right, 410-768-5522. And so that's a number, it's not a 911 number, but it's a number that you can get a trained response 24/7 to those kinds of crisis calls. Questions?
right. Mike writes, what kind of funding do we have for the addict who has no family and have lost everything? Well, Mike, I don't know if you're referring to resources for day-to-day living or resources for the treatment that someone might need. So we'll do 2-prong. I think the first phone call, if you're looking for resources for day-to-day living, that would be a phone call to social services.
Correct.
And then the second phone call would be to the health department.
So there are recovery housing available, and this is really important as people progress through treatment. They get sober, they get stable, they want to settle down and get back to their lives, they get a job, but they may have totally gone through all of their assets and have no ability to even pay a first month's rent check. What do you do? And so that's the incredibly important role of recovery housing. And we've got a very strong recovery community in our county, and access to information about where those recovery houses are can come through that website, Angel's website. Did you have that Angel Trainer's website, which is, I believe, recoveryarundel.com. A tremendously important resource for people who want to get their lives in order and stay that way. It's a really supportive community, no stigma, and really to be surrounded by people who are in recovery so you can socialize without the fear of having that kind of exposure.
Well, the county also has a new resource for citizens seeking services, and that is simply calling 311. County Executive Shue, can you talk to us about 311?
311 is a new initiative that is separate and apart from 911. 911 is, of course, for medical emergencies, heart attacks, overdoses. But if someone is having a serious problem with housing or food insecurity or a lost pet or a pothole or a burned out street light, call 911 and call 311. 311, the non-medical emergency response line, and the operators will connect you to the services you need. So I think if you're looking to connect someone who has got no shelter, no assets to make that first month's payment of rent or security deposit, we can get you to the right place by calling 311.
We haven't talked about the Sheriff's Department yet. I know they have a role too when it comes to warrants.
Yes. The Sheriff's Office plays another indispensable role in this whole effort. The most important responsibility on a day-to-day basis of the Sheriff's Office of Arundel County is apprehending criminals who are on the run, people for whom there are outstanding warrants for their arrest, who are evading law. These sheriff's deputies are amazingly brave individuals who find these people, these suspects, and enter their place of residence or place of business, putting themselves most definitely in harm's way, and bring them to justice. Now, we've been working with the Sheriff Ron Bateman, over the past 2 years on this heroin crisis in particular, and he has developed a technology that has allowed him to prioritize his warrants. There are approximately 12,000 outstanding warrants, believe it or not, in Arundel County. The sheriff has been able to prioritize those warrants electronically so that the ones related to heroin come right to the top. And the sheriff's deputies are putting maximum effort on getting people whose warrants are related to heroin dealing and distribution.
Have we in Arundel County collaborated with any other local jurisdictions across the state in discussing what programs they have in place, how we can learn from one another?
Well, we're in constant communication with other jurisdictions. Arundel County's borders with Prince George's and Calvert and Baltimore City and Baltimore County are all rather porous, as we all know, and the heroin distribution networks have no regard for borders whatsoever. We believe that the vast majority of our opiates, of our illegal opiates, are coming in from Baltimore City. Those opiates themselves are coming down from the New York, New Jersey area through the interstates. And so we are in constant communication with law enforcement, the law enforcement community across the region to make sure that our efforts are coordinated.
Great. Fran, I get phone calls in my office from the family members telling me how the addict's illness is just tearing apart the family. What resources, support groups are in our community to support the family members?
Right, it's really important. And a lot of our treatment providers in the county, the residential treatment providers, and I'll name some of them, they're outstanding. It would be Pathways or Hope House, Godenzia. They have programs for their family members of their patients. So right there at the site of treatment, there are very active support groups for families. And you know, we also, we need to think about the children, because so many of the people that we're seeing, particularly the overdose victims, are people of the ages that they are children's parents. So this has a ripple effect through the generations. And really, this is a key concern of the school nurses. Like, what will we do? How will we deal with traumatized children? So school nurses can be an asset in that. And again, the health department has access to recovery communities. So really, it's an idea of reaching out wherever a person feels comfortable in the family member to get that kind of help.
Well, we're nearing the end of the session, but so before we do that, I want to talk about stigma and hope.
Okay.
How are we as a county working on breaking the stigma, reducing the stigma for the family and or the addict? I know that a lot of people don't even like the word addict. It's
Right.
a person
Right.
with a brain illness.
Right.
So how are we moving forward in this reducing stigma and providing hope for others?
Thank you, Nancy, for that question. That's the heart, that's a fundamental question of denial, and with denial comes lack of treatment and lack of addressing the problem. I have to say, when I first became health officer back in the 90s, we were dealing with a public health crisis in Anne Arundel County that had a lot of stigma attached to it, and believe it or not, that was cancer. At the time, nobody wanted to talk about cancer. Nobody wanted to talk about breast cancer. Nobody wanted to talk about prostate cancer. There was stigma attached to that. Well, you see, what's happened is we've broken through that. It's now a very common conversation every day, and people know about getting screened, people know about treatment for cancer, and it's no longer stigmatizing, and it's a disease that now we look at with hope. And the same thing will happen with substance use. We're not there yet, but the kind of work that as a community across this county we're doing to have the conversation, to talk about that, that's the first step to getting rid of that stigma. We can do that.
I'd like to also let everyone, or remind everyone, if you haven't heard, we are doing an event, Breaking the Silence, on September 13th. County Executive Shue and Mayor Panelides will be joining us with that conversation. We've targeted our clergy, our faith-based leaders, their youth ministers, and yes, and it's open to the public. It's just the continuing conversation and how we can bring in other communities, just about spreading the word and the education that is so needed. So I encourage everyone to attend. That's September 13th at St. Helen and Constantine Greek Orthodox Church on Riva Road. You're all welcome. The doors open at 8:45 a.m. It's going to be a great event. Again, County Executive Shue and Mayor Panelides will be having opening remarks and participating.
And underscore all are welcome to these events.
Yes.
Whether you're a family member or you are yourself suffering from substance use disorder, or whether you have a friend, or whether you're just concerned, just plain concerned from a public policy perspective, come, because that way you will learn more about it, and then you can be another ambassador in the community. Ginger says, the more you talk about substance use, the more people will understand. Hear, hear. That's what education's all about, and it's not just Nancy and our team here. It needs to be all of you. You all have to be part of the solution. Let's educate each other, learn from each other, and then fan out and talk to everyone in the community about this crisis.
Right. And a shout out to Ginger. Hey, good morning, Ginger. Thank you for your continued support. Ginger is a mom who tragically lost her son Jake to a heroin overdose. She is actively engaged with the Not My Child team, and she's a support specialist with the Maryland Coalition for Families, which is another great resource. Were you going to say something? Nope. Okay.
You got it.
So, Chris. Oh, hey, Chris. Chris was with us last week. Thank you for the compliments, and you too are very much a part of the program, and I will be contacting you to sit as a panelist on one of the many events we have coming forward. So as we conclude this morning, I want to remind everyone of two things. You can easily follow the Not My Child and the prevention education that we're doing through the county's website. It was posted earlier, aacounty.org/heroin. Visit the health department's preventsubstanceabuse.org website. And next week, our 5th Facebook Live series will be with our own Chief Tim Altamari, Chief of Police, and the Director of our Crisis Response Teams, Jen Corbin. We look forward to that conversation. Everybody have a great week, and we'll see you next week. Thank you.